I'd like you to imagine that you are a new parent living in Canada, recently widowed and living on your own with a small income. You have 2 young children and you suddenly have to go to the ICU for the baby, and you do not know for how long or when you'll be back home. Your only support is your elderly mother who has COPD and is made essential to your care for you and your babies, and this places a safety risk for her, the staff, and your family. In another example, imagine that you are the only caregiver for your aging parents who have dementia, and they no longer know you, and you are their essential partner in their care. Never want to see you in their care home because you cause them anxiety. Imagine the feelings of heartbreak, worry, and mental stress that is placed on you and your family. Hi, my name is Stewart, and welcome to my closing remarks about my opposing position that family members be considered essential partners in acute and long-term care settings. I worked in home care for 11 years and can empathize with family members who are caregivers in their families and saw firsthand the burnout and grief that people endure. I'd like to thank my opponent for her hard work during the debates and for the interesting dialogue throughout the debate. I would also like to thank everyone who participated and commented on our debate. I am in the opposing position on the topic that family members should be considered essential partners in acute and long-term care settings. My 3 claims again are that placing families as essential partners can increase safety risks, such as COVID-19, increased transmissions, burnouts, mental health distress, burdens, and ethical issues for families, staff, and patients. Burnout harms people's mental health due to the increased fatigue and stress, affecting more than half the caregiver population. Paid and unpaid caregivers suffer from grief, guilt, anxiety, worry, and tiredness from the overwhelming caretaking responsibilities. My opponent has brought forth some evidence that states that family care partnerships are in place in Canada, but that these are only guidelines made by the organization's recommendations. The Canada Health Act has no regulations or policies with family members as essential care partners for ethical and safety reasons to protect patients' health. While my opponent and I agree that family is crucial in meeting the patient's needs, her 4 arguments were riddled with fallacies. Starting with her first claim, the widely supported family-centered approach is evolving towards a family as partner approach. Her first fallacy was circular reasoning. However, I oppose it because it is not widely supported and the family-centered approach is different from the family as partner approach. The next fallacy in her second claim is her hasty generalizations. This will have you believe that family partners are essential care partners. Her third claim fallacy is called the slippery slope. This will have you believe that withholding family is bad for patient outcomes. Lastly, her fourth fallacy is begging the question for her claim. This will have you believe that it is completely necessary to have positive incomes. We all want what is best for our families, so why make them essential partners if it will cause more burdens? Why is family essential in an already stressful care planning in the acute stages, or especially the long-term care stages? Why not allow the family or its members to choose to be supportive or choose their family carers wisely to accommodate them and their loved ones? Again, I implore you to look at the statistics of family burnout and the higher stress of staff already, and ask yourself if you want your family to be essential partners and risk their mental health, intrude on their personal family time, not making them feel burdened and displaced in their lives if they are deemed essential partners in care. Thank you.